What is an enlarged prostate? An enlarged or big prostate happens when the walnut-sized gland near a man's penis and bladder gets too big. This can be because of getting older or from inflammation or prostate cancer. When the prostate is big, it can make guys over 50 have problems like peeing a lot or feeling like they have to pee right away. Getting treatment for an enlarged prostate usually works well, but because cancer could be the reason, it's crucial not to ignore signs of prostate problems. What are the symptoms of an enlarged prostate? Sometimes, when a man's prostate is bigger than usual, it doesn't always cause problems. Around half of men with this issue don't feel anything wrong. For some guys, the symptoms show up early, while others don't notice anything until their prostate gets much bigger. This depends on where the enlarged part of the prostate is compared to the bladder. If you start having symptoms of an enlarged prostate, you might feel like you urgently need to go to the bathroom a lot. But when you get there, you might only pee a little and have a weak stream. You might also keep leaking or dribbling even after you've stopped peeing. The most common signs of prostate enlargement include 1. Peeing more often than usual. 2. Feeling a strong need to pee urgently. 3. Waking up several times during the night to pee. 4. Having trouble starting the stream of urine. 5. Not completely emptying the bladder. And 6. Losing control of your bladder. What are the complications of an enlarged prostate? Not fully emptying your bladder can lead to a urinary tract infection or UTI, causing pain and burning when you pee. If you get a UTI, you might also have trouble controlling your pee. A UTI or cancer can make your pee have blood. If you see blood in your urine sometimes, talk to your doctor. If you have blood clots in your pee or can't pee at all, get medical help right away. Severe blockage can harm your kidneys. What are the causes of an enlarged prostate? Men have a part called the prostate gland, but women don't have it. The prostate is situated just below the place where the bladder lets out urine through a thin tube called the urethra. In men, the urethra goes through the penis to the outside of the body. When the prostate gets bigger, it can affect the flow of urine through the urethra. There are a few reasons why the prostate might get larger. Cause number 1, benign prostatic hyperplasia, BPH. Benign prostatic hyperplasia, BPH, is when the prostate gets bigger, but it's not cancer. About half of men in their 50s and 90% of men over 80 have BPH. The prostate grows because of male hormones like testosterone. In teenage years, it grows quickly, but it slows down after puberty. As men get older, the prostate keeps growing, but it happens very slowly. Most men don't feel any problems with BPH until they're older, and the prostate has become so big that it affects the flow of urine from the bladder. Cause number 2, prostatitis. Prostatitis means the prostate is swollen. It can happen because of an infection, inflammation, irritation, or injury. Cause number 3, prostate cancer. Prostate cancer might make the prostate larger, but it doesn't always show signs. It can be found early and treated effectively. If not treated, it can spread to other parts of the body. How is prostate enlargement diagnosed? If you're experiencing problems because your prostate has grown bigger, figuring out why just from your symptoms can be tricky. Since the signs of prostate enlargement or BPH and prostate cancer are a lot alike, it's crucial to consult with your doctors to find out what's going on. Diagnostic option. 1. Physical examination. As part of your checkup, your doctor might do a test called a digital rectal examination or DRE. This helps them check your prostate, which you can't see from the outside. It's a simple procedure where the doctor puts a lubricated gloved finger into your rectum to feel the size and texture of your prostate. This test shouldn't hurt or make you bleed. If it does, it could mean there's an issue with your prostate that needs more checking. If your prostate feels bigger, lumpy, or uneven during the exam, your doctor might suggest more tests. Diagnostic option 2. Blood and urine tests. A prostate-specific antigen or PSA blood test checks for a protein made by the prostate. If the PSA levels are high, it might mean cancer, but it could also be due to prostatitis. Sometimes men with prostate cancer have normal PSA levels. This test alone can't determine the exact cause of prostate enlargement. A urinalysis measures how much urine you produce and can find blood, inflammation, or infections. Keep in mind, it's usually suggested for older men to get screening tests like a digital rectal exam or prostate-specific antigen test, especially if there's a chance of prostate cancer, even if they don't have any symptoms. Diagnostic option 3. Specialized tests. There are tests to check how well you can pee. Some tests involve putting a tube into your penis to find any blockages or changes in how pee flows. Urodynamic tests give your doctors information about how your pee flows and can find problems with the structure that might be making it hard to pee. Pressure flow studies. Check the pressure in your bladder when you pee to find any blockages. Uroflowmetry measures how fast your bladder fills and empties. A post-void residual urine study checks how much pee stays in your bladder after you pee. Your doctors might use a combination of these tests to understand how your bladder and prostate gland are shaped and how well you can pee. Diagnostic option 4. Imaging examinations. You might have to get pictures taken inside your body, like a CT scan of your belly and pelvis or an MRI of your prostate. Another kind of picture test is called a transrectal ultrasound. It means putting a tool into your rectum to take a picture of the inside parts. Diagnostic option 5. Biopsy. If there's a worry that your big prostate might be due to cancer, you might have to do some tests called cystoscopy or prostate biopsy. These tests collect a small piece of tissue from your prostate and check it under a microscope to see if there are any signs of cancer. How is an enlarged prostate treated? There are various ways to treat an enlarged prostate. It's crucial to manage the symptoms, and treating the root cause is usually really important too. Treatment option 1. At-home management. Here are some simple tips to help you avoid problems like peeing unexpectedly, going to the bathroom a lot at night, and getting bladder infections. 1. Pee regularly and when you feel like you have to. 2. Cut down on drinks with alcohol and caffeine. 3. Stop drinking liquids a few hours before bedtime. 4. Talk to your doctor about any over-the-counter antihistamines and decongestant pills you're taking because they might make bladder issues worse. 5. If urinary retention is a chronic problem, you may need to learn how to catheterize yourself. This involves placing a thin tube into the urethra to release urine. 6. Be careful with products that claim to use herbs or supplements to fix prostate problems. There's no proof they really work. Treatment option 2. Medication. Different types of medicines are used to manage symptoms or treat an enlarged bladder. Some medicines called 5-alpha reductase enzyme inhibitors can shrink the prostate gland in conditions like BPH and prostate cancer. Examples are Avodart, which contains dutasteride, and Proscar, which contains finasteride. These medicines may have side effects like lower interest in sex and breast enlargement, but these effects can be reversed. There are also medications, known as alpha blockers, that can help with urinary symptoms by relaxing the muscles around the urethra. Examples include Flomax, which contains tamsulosin, Cardura, which contains doxazosin, Hytrin, which contains terazosin, Rapaflo, which contains silodosin, Minipress, which contains prazosin, and Uroxetrol, which contains alfuzosin. These medications may cause low blood pressure and dizziness. If prostatitis is caused by a bacterial infection, antibiotics can be used for treatment. So, in summary, Lots of men experience a larger prostate, which is quite normal. If there are no signs, you usually don't need treatment for BPH, but if it's prostate cancer, you always need treatment. Some guys think peeing a lot is just a normal part of aging, but if you notice these symptoms, it's important to see a doctor. Even if you've gotten used to them, it's worth checking to make sure it's not a serious and treatable health problem. Thank you for watching. Don't forget to like, comment, and subscribe. Watch more videos by clicking on this video right over here.